Hi, my name is Abby and this is Vlog 6 for my INFM645 class. Today's question is electronic health records create a number of risk in healthcare organization, list them with examples and justify how you can resolve these issues. The second question is document how an EHR work with the risk information system. So what is EHR? EHR is the systematic collection of patient and population electronic stored health information in a digital format. So basically what that's saying is that EHR is patient's record documented or stored in a digital format. Electronic health record can make healthcare more efficient and less expensive and improve the quality of care, making patients' history easily accessible to all who takes care of them, treats them. However, as the healthcare industry adopts electronic records, challenges as also arise that has a potential financial loss, which is probably due to being sued, lawsuit, or the facility packing up due to the lawsuit. And it also poses some danger to them. Like all other computerized systems, they are also vulnerable to crashes. So let's say the system crashed down. My examples are one, and unauthorized access to patient information. So let's say someone that's not authorized get into the system and get the information that they need to do harm instead of good. Like an example would be an employee left their computer unlocked or not password protected. So that someone walking by, or even I know like there's some facilities where customers or patients or someone that is not being seen can just walk, down. So what if they just pop in and look in the system and put down some information that could probably help them to do whatever they want to do with it, or they can just see a patient's information just lying out there. So to help mitigate that, employees want to use password protected, encrypted password. They want to use the I forgot what it's called. It's like a screen cover on your laptop, so someone cannot just pop their head and look at your screen, your computer screen. So a screen protector. And another reason is also inaccurate patient information if records are not updated in real time. So say like a patient came in today and had some stuff done and their record wasn't updated until like the next day, but then the patient came back later on that day, like a 72-hour rule kind of thing, but their records wasn't updated yet, because they came back right back. That could trigger duplicate lab being done or duplicate prescription being given to the patient if they didn't use the same pharmacy. Another one will be so we want to have a system that is documented in real time, that updates, as you put it in. Another example is unavailability of EHR system due to technical problems like downtime. Say like there's a system glitch or something. It could result in duplicate entries being put in the system if there was a glitch and it didn't save your work that you put in there. Backup procedure protocols should also be implemented. So like say like there was like bad weather or something and the system went off and there was no backup, protected system like a gen or something. But usually most hospitals have like a backup gen. So whenever there's a bad weather or whatever, it usually pops right back in seconds. Sometimes it might create a delay. So, you always want to save your work as you enter anything in the system. Another one would be potential malpractice liability, like data loss or destruction or inappropriate corrections to medical record, typo, errors related to problems that arise during the transition of EHR system. So an example would be like from legacy system to a new system. Sometimes I know when a patient comes in and they're still on the legacy report, maybe legacy system, so when the payment comes in, it might be posted, or comes in through the new system, or the poster might make a mistake and post it through the new system, posted in the new system. So if everything didn't get completely moved from the legacy report to the new system, then that could trigger errors, for the patient or the insurance company. I've seen that happen a couple of times whenever like hospitals are in transition with legacy system and new system. There's always like a back and forth with that. So that would be that it didn't transfer correctly. So what they want to do is transfer the what needs to be transferred correctly before they go live, or just keep using the old system and then make a date that, oh. And the last question that says document how EHR work with a risk management information. So my example would be a worker goes to her primary care clinic for follow-up on her type 2 diabetes. Despite taking all her medication correctly, her diabetes is still poorly controlled with hemoglobin A1C of 9.5. She had previously provided information on her work as a medical assistant at a local hospital working the night shift. This information, including fields for current employment status, industry, occupation, and work schedule, was recorded in the EHR system. When the nursing staff came in the room to enter the reason for her clinic visit that day into the EHR system for her shift complaint, this information triggered a pop-up box that stated that the shift work can affect diabetes control and provide a recommendation on diabetes management among shift workers. This clinical decision support tool allows the providers to adjust the patient's medication and provide educational resources to improve the patient's health. So basically it was like something in the EHR system that prompted the nursing staff when she keyed in the patient's chief complaint. It popped up that a nightly shift duty could in fact impact her diabetes control, because probably she eat late at night, or some of the stuff that she does eat at night since she works night shifts could have an effect on how the diabetes is being controlled. So that sort of will answer how EHR works with a risk management information system. So stuff like that to clue you in, or like let's say patient have like a medication allergy or something. So if that's already prompted in the patient system, so when they put in the wrong type of, even if it's the correct medication in there, there could be a drop down that will just drop down and say patient is allergic to something, So that, I think, is how a EHR will work with a risk information system. And so that concludes my vlog for today. Thank you.